Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today in my Health Conditions 101 series, we're going to be talking about depression. Now, this will be very much factually driven and very much an overview of depression, and I just wanted to make note here that depression and all mental health conditions are really nuanced. So please don't take this video as the way that I'm describing things being the only way one can experience depression or the only way that it can be diagnosed. I wanted to make it very clear from the get-go that's not the case. Please also know I'm going to be talking specifically about major depressive disorder, MDD, as depression. And the reason I do this is there's actually more than one type of depression. There's cyclothymia, dysthymia, there's the depressive side of bipolar affective disorder, especially type 1, but also type 2. So I just wanted to make that clear from the get-go. I never want to group very nuanced conditions together and just make them very stereotypical, because that's just not the case. That's not how it is. I also want to make it clear that I'm someone with a lived experience with depression, and it's really, really common. And I don't want it to be stigmatized. It's just as valid a medical condition as diabetes or diverticular disease or a cancer. It can also be just as devastating as those diseases or conditions. So that's enough disclaimers, because they went on for a while. Let's talk about depression, specifically major depressive disorder. As I alluded to, depression, specifically major depressive disorder, is a significantly common mental health condition that affects 5% of the population. So that's 5 in 100 or 1 in 20. Depression itself is a complicated disorder, as I've kind of alluded to, wherein a person experiences for a long period of time a combination of symptoms including low mood, a loss of pleasure in or interest in activities, and feeling irritable or empty for most of the day, almost every day, for at least 2 weeks. There is no singular cause of depression. The way that we understand it now is that it's a complex interplay between biological, social, and physical scenarios or factors, and there's quite commonly no one precipitating cause, although situational depression also does exist. We also can't ignore that adverse life events can really affect someone's mental health and may precipitate a depressive episode or a depressive disorder. So I kind of mentioned very quickly earlier the signs and symptoms of depression, but let's talk about them a little bit more. As per the DSM-5, which is the diagnostic manual we use to diagnose mental health conditions, these symptoms must be present almost every day for almost all day for at least 2 weeks. And that includes having a depressed mood, feeling low or irritable, having a loss of interest or pleasure derived from activities that would normally bring you joy, changes to your sleep patterns, so sleeping too much or too little, changes to your appetite, so again, maybe eating too much or too little, feeling fatigued and low energy, having an inappropriate amount of guilt for something that doesn't call for that level of guilt, or feeling worthless. Having depression diminishes your ability to think and to problem solve and to just process things. So you might feel cognitively slow or like you've got a brain fog. And finally, and the most devastating part of having depression, is that for some of us with it, there are recurrent thoughts of suicide, self-harm, or death. There is no one way to investigate depression. As I've alluded to, we do use a manual to help with the diagnosis. However, there are other causes of all of the symptoms I listed before. So before we make a diagnosis, we have to ensure, and this is part of the DSM-5, that we rule out any other things that may be causing these symptoms, which also include, talking about the use of illicit drugs, which can cause depression. It involves a blood workup to ensure that there's no other deficiencies like an iron deficiency or a tumor causing these things, that your thyroid function is fine, that you're not low on vitamin D. It's really important, again, to ensure that when we're talking about major depressive disorder, that we are diagnosing someone with the right thing, because other conditions that may have a depressive component to them include, and I kind of alluded to before, psychotic depression, antenatal depression, postnatal depression, bipolar affective disorder, cyclothymic disorder, dysthymic disorder, and seasonal affectiveness disorder. Then we talk about severity and figuring out just how much this is affecting someone, which can affect our treatment. And again, you can't measure depression. You can't measure it like you can a blood sugar. So we use subjective scales such as the K10 or the DAS-21, which is the Depression, Anxiety, Stress Scale, 21 questions, to determine the severity of the symptoms. But again, this is not diagnostic, and just because you score low on a scale or high on a scale doesn't take away from the effect it has on you and your lived experience. So what do we do to treat depression? Again, it's really nuanced, and having, a quick 5-minute video on this is in no way a replacement for the hours upon hours of lectures and the books upon books written about depression. But the way that we attack it can be twofold, or at least I like to talk about it twofold. There is the biological component. So for some people, there is a lack of proper use of chemicals in the brain, such as serotonin, which can really precipitate a depressive disorder. And then there's the psychological component, which is the way that we think, and the way we interact with the world, and the way that we process information. So as you can see, the two-pronged approach would be almost first and foremost counseling, psychological therapy, referral to a psychologist, but also the consideration of using antidepressants. And I've done a whole video on antidepressants, so I do encourage you to watch that. But long story short, for some people, this is a short-term thing, and for some people, it's a long-term thing. Ultimately, a combination tends to be the best treatment, but some people don't need medications, and that's fine. And some people are, for whatever reason, really closed off to the idea of psychological therapies. So we may use medications on their own. Your journey will be very different for you, obviously. The last person that may be involved in all of this is a psychiatrist, so a doctor who has specialized in mental health conditions. From a psychiatrist's point of view, there are other avenues of treatment open for people with depression, especially those that are resistant to mainstay treatments like antidepressants and psychology. And that may include TMS or electroconvulsive therapy, ECT, or other medications that, for example, myself as a GP could not prescribe. Ultimately, there is hope, and there's a lot that one can do with their lifestyle as well that can improve their mental health. So, getting enough sleep, eating well, getting in the sun for a few minutes a day, expressing gratitude. But that's really ableist and privileged sometimes to have the time to be able to do that, to have the resources to do that. I guess a personal gripe I have is that there seems to be this notion that if you just journal every day, write down 5 things that you really enjoy, and have a positive mental attitude and mindset, that you'll cure your depression. It's kind of like, just be happy. But no, that's something that I have difficulty with. So whilst I think that absolutely has a role to play, and I personally have noticed a significant improvement in my mental health when I am eating generally well, exercising frequently, I do have a routine, I don't ever want anyone to hear that and go, well, I do all of that and I'm still depressed, so I'm a failure. Or I don't have the time or the money to do that, so I'm always going to have depression, or always have the symptoms of depression. And that's not the case. Above all, I strongly encourage that you chat to your GP about your mental health if you've got any concerns about it. If you think that you are more tired all the time, or that you're sad all the time, or you're always anxious, or you've had a chat with a friend and you've explained something that you think is normal and they go, that's not normal, I strongly recommend that you chat to us, because we are there to help. So that's it, guys. That's Depression 101. Again, a really quick, 5-10 minute video on a very otherwise nuanced topic. And I do not claim to have covered absolutely everything in this video. If you want me to go into any detail about anything in particular, let me know. Remember, I do have a whole video on antidepressants, including my lived experience with them. And I also have a story about my own burnout journey, which is, I guess, in part of my depression journey as well. So above all, other than just obviously fragrant self-promotion, I just want to let you know it's normal. 1 in 20 of us, you're not alone. So if you like this, please leave a like. If you haven't already, please consider subscribing. I release a new video every week. And until next time, guys, stay safe, stay healthy, and I will talk to you very soon in another video coming your way. See ya.